If you're in your early 40s and you're starting to deal with those early perimenopausal symptoms like difficulty sleeping, rising anxiety, or worsening PMS, and you've tried all of the things through your diet and lifestyle and you still feel off, then this video is for you. Today we're going to talk about how bioidentical progesterone may be the missing piece in the puzzle for you and why it helps so many women feel like themselves again. In the first video, we talked about how perimenopause typically unfolds, and we mapped out a timeline to give you a framework to think about this journey. But today I want to focus on something more practical, how progesterone support can help during the early perimenopausal transition. One of the reasons that early perimenopause can feel so hard is that progesterone often declines first, while estrogen is still cycling, sometimes erratically from cycle to cycle. And this imbalance between progesterone and estrogen is often what contributes to a lot of the early perimenopausal symptoms like insomnia, anxiety, heart palpitations, or worsening PMS. These symptoms aren't random. They typically represent the fact that progesterone is declining while estrogen is still hanging on. And this mismatch or imbalance between progesterone and estrogen is really important to understand, especially in that early perimenopausal transition as we think about treatment options. But before we dive into hormone replacement therapy, I do just want to emphasize that the foundations really do matter. Nutrition, exercise, stress mitigation, sleep, and digestion all influence how symptoms are experienced. We covered these in more details earlier in the series, but for now I want to emphasize that if you need progesterone support in this phase, it doesn't mean that you've failed diet or lifestyle modifications. It simply means that you may need more support than what those interventions can offer, and that's completely okay. So let's talk about progesterone. Bioidentical progesterone does so much more than just help to regulate the cycle. One of its most important actions is that it interacts with GABA receptors in the brain, and this creates a sense of calm and promotes deep restful sleep. This is why many women in the early perimenopausal transition often experience worsening anxiety, insomnia, worsening PMS symptoms, or even heart palpitations. As progesterone levels decline, the nervous system can feel more activated, and these symptoms can significantly affect quality of life. Beyond how you feel day to day, progesterone also helps to counteract the effect of estrogen on the uterus. When you have relatively higher levels of estrogen compared to progesterone, this can contribute to things like heavy periods and painful periods. Progesterone also plays a really important role in brain health, bone health, and metabolic support as well. So for many women, supporting progesterone in this early perimenopausal phase can help them feel like themselves again. Now, when we talk about progesterone in this situation, I'm specifically referring to bioidentical or micronized progesterone. We're specifically not talking about synthetic progestins. These are entirely different. So the most common form of bioidentical progesterone is called micronized progesterone, and it's typically known by a brand name called Prometrium. There are other versions out there, and this can be compounded. Compounding may be especially important for you if you have a peanut allergy, because Prometrium is a peanut-based capsule. Compounding can also be incredibly helpful if you need individualized dosages that aren't available in the standardized form. Now, progesterone might not be appropriate for everyone, and there are a few important safety considerations to be aware of. These include unexplained vaginal bleeding, certain blood clotting disorders, liver disease, or a history of hormone-sensitive cancers. And the decision whether or not to start progesterone therapy should always be individualized and discussed with your personal healthcare practitioner. One thing that often surprises many women is that earlier in this transition, a woman's need for progesterone might actually be higher than it is later on in the transition. And the reason for that is important. During early perimenopause, estrogen levels are still cycling, and in some cases, estrogen can even be higher than they were prior to the transition. In women who still have fairly regular cycles, progesterone is often used cyclically during the luteal phase of the cycle. So that's generally the last 2 weeks of the cycle after ovulation. Using progesterone in this cyclical approach allows progesterone to work with your body rather than against it. And by supporting the luteal phase of the cycle, where progesterone is naturally meant to rise, hormone signaling can feel more balanced and day-to-day symptoms can be improved. In women with more irregular cycles, which often happens later in the transition, progesterone can be still used cyclically or on a daily basis throughout the cycle. Dosing really depends on each individual, their cycle length, duration, symptoms, and their individual response to therapy. So I really want to emphasize this, that dosing in the early perimenopausal phase is highly individualized. These decisions should be made thoughtfully and with guidance, so you're not left guessing or experimenting on your own. Lab testing can be helpful, but it's definitely not perfect. In perimenopause, hormone levels can fluctuate from week to week, and even day to day. And levels don't always correlate with symptoms. And there's no lab test that can confirm endometrial protection, which means numbers alone don't tell the full story. So patterns, cycle context, and your lived experience matter often just as much as labs. Your body is telling a story during this transition, and learning how to tune in and listen closely can be an incredible part of this journey. Early perimenopause can certainly feel destabilizing, but importantly, there are thoughtful, supportive strategies that you can employ to help your body through the process. In upcoming videos, we'll talk more about how you can support your sleep, your cognition, your stress and mood, and overall well-being so that you feel more grounded, empowered, and confident when it comes to your health. If you feel comfortable sharing, I'd love to know what part of the early perimenopausal transition feels the hardest for you right now. I'm Dr. Kate. Thanks for being here, and I'll see you in the next video.